Hi, my name is Anna. I am a health science student at Western Sydney University. Today, I will talk about the significant health issues of type 2 diabetes mellitus in Australia and the United States. I will present and classify and definition providing epidemiological data and the burden of disease. Finally, I will discuss how each country has responded to prevent this disease. Type 2 diabetes mellitus is classification of ICD-10 code E11. It is one of the chronic disease disorder when the body cell resistant to insulin or when the body loses the ability to produce sufficient insulin in the pancreas. If glucose is too much, it will go to the bloodstream or not sufficient to reach the cell. It is common in over 45 and is associated with lifestyle choices such as smoking, insufficient physical activity, unhealthy diet, and sometimes genetic. Most of the patients with type 2 diabetes do not recognize the signs and symptoms. People often feel excessive thirst, hunger, frequent urination, experience weight loss or gain, fatigue, and blurred vision. Moreover, patients have darkened skin, often located in the body's armpit and leg. Between 2017 and 18, 1 in 20 Australians had diabetes, 1.2 million, and around 1 million Australians had type 2 diabetes mellitus. The number of Australians with type 2 diabetes has increased in the last decade from 3.5% in 2007 and 8 and remains stable in 2000, since 2014 and 15 with 4.4%. Diabetes was more common in males than females since 2001, and diabetes increased rapidly in both age groups of over 45 years old. In America, 1 in 10 Americans have diabetes, around 34.2 million, and 90 to 95% had type 2 diabetes in 2018. The proportion of older and younger people with diabetes are increasing. In 2017, there were 4,839 Australian deaths caused by diabetes and stood at 7 in the country level. Similarly, the United States also was in the top 7 leading cause of death with 83,564 American deaths. Between 2015 and 16, the Australian government healthcare system spent around 2.7 billion on diabetes treatment. On the contrary, only in 2017, the United States estimated 327 billion in expenditure for diabetes treatment. Australian government has responded to diabetes as a national disease. There are several programs funded by the government to prevent, treat, and manage diabetes. For example, Diabetes in Australia, focused on the Future and National Diabetes Services Scheme, runs several programs with funds and support from the government. For example, GiveSight is a program to encourage people to check their eyes frequently. Therefore, Australians can enjoy a healthy life. The American government had responded to diabetes epidemic with the Centers of Disease Control (CDC) operation which organizes the national program Changing Lifestyles to prevent type 2 diabetes. This program provides subsidies to continue training physician nurses, pharmacists, and others, and participates in partnership with other organizations to deliver lifestyle train programs with different partnerships around US. CDC deliver a different organizations and other nation DPP direct participation program lifestyle change programs like cooking a healthy recipe, laugh, sharing. In families, parents and children can prevent type 2 diabetes by developing good family habits such as drinking sufficient water, reducing intake of sugary food and drink, eating enough fruit and vegetables, cooking and making healthy food dishes, and having enough physical activities like cycling or jogging. There are 5 ways to prevent type 2 diabetes. Exercise regularly, maintain a healthy weight through healthy fat such as olive oil. Focus on fast food and cut or stop sugaring soft drink and fast food. If we can start now, we can save our future generation from this deadly chronic disease so that they can live a healthy life. It also helps the government to remove this burden of health care for medical issues caused by diabetes. I hope you enjoyed my presentation and thank you very much for your time.